Hey, so this message is for moms that have kids that either need a thickened liquid. Like my son, he is 4 years old. All of his liquids need to be thickened with Thicket because we have a swallowing disorder. So some moms might already know this, but I didn't always know this. And amazingly, providers never told me this. So my son didn't really need any kind of pain medicine or really any kind of medicine for pretty much 4 years. And now whenever we get sick, sometimes we may need Tylenol, for pain or whatever. And nobody really seems to tell you this, but there's something called FeverAll. Okay, it's a Tylenol suppository. And yes, I know that most of the times suppositories like this are for infants, but if you have a 4-year-old that's in a lot of pain and they can't swallow liquid medication or chew a chewable tablet, FeverAll suppositories are absolutely amazing because you put it in and the kid obviously will feel better. So of course, you have to ask your provider, but I really wasn't told this, and I guess when you're 4 years old, that's not a common thing. You don't usually do it this way, but if you have to, you have to. Also, I wanted to note that things are expensive nowadays. People are hurting with money. So you can get these covered by insurance a lot of times, but nobody will tell you that. And a lot of times the provider's office doesn't even know if it's covered or not. So I always usually ask to just write a script and cross my fingers that it's covered. So I had to get this recently for my kid. The provider called it in, no problem. But the pharmacy wanted to be like, oh, that's not covered. And I'm like, no, I know it's covered because I remember quite some time ago, I vaguely remember getting these and it was covered. So what it is, if it's not covered under the brand name, like FeverAll is like the brand name, you can get just the generic version, usually covered by insurance for Tylenol suppositories. I know it's not actually called Tylenol. It's like acetaminophen suppositories or whatever the official generic name is. Do you know what I mean? So anyways, I just wanted to put this out there saying you can get it covered, and more importantly, your kid that can't take things orally can have some relief. I really think though that there also needs to be some kind of change in medications, because we have needed oral antibiotics and it's really, really hard because there's no kind of alternative administration for oral antibiotics other than an injection or IV, right? I just wish that there was some kind of alternative, you know how they have a nicotine patch, right? Why isn't there an antibiotic patch, or maybe some kind of Listerine strips? Why isn't there some kind of dissolving strip type antibiotic that you can put on your tongue? I wish that there was more alternative options for kids that have swallowing disorder or laryngeal cleft to get antibiotics without it having to be an injection, because we've had to do that before, or without it having to be IV antibiotics. So anyways, I hope this at least helps somebody. Thanks for listening.